Information overload is a real challenge for all of us as healthcare professionals. Because of the rapid advances in medicine, we're bombarded with guidelines. So that makes it phenomenally challenging for myself and colleagues as physicians to keep up to date. Like all my colleagues, I want to provide best care to my patients, the very latest treatments, interventions that are going to improve both quality and quantity of life.
Historically, physicians would get information either from their monthly journal that they subscribed to, which was a print journal, or pharmaceutical sales reps might come visit the physician at the office or the hospital. But now physicians rely on digital channels like Medscape to really get information in a real-time basis. Medscape's main value is to improve patient care all around the world. And we do that through providing editorial content that is credible and relevant to physicians regardless of geography and regardless of their specialty. About 10 years ago, we formed WebMD Global, which basically brought Medscape to the rest of the world. So if you fast forward to today, we reach about 6.5 million physicians around the world in almost every single country. We generate content in over 35 different languages, and we provide news and reference and education to physicians really in all corners of the earth.
There has been a widespread decreased well-being to healthcare providers. That's due to increased administrative tasks, long shifts, they're underpaid, is really overwhelming fatigue that clinicians have had for years. Medscape contributes to improving the well-being of clinicians by pivoting with the times as they change.
We have our platform alone carries simulations, text-based activities, videos, podcasts, both on and off of our website. We have our app, which carries all of those things as well. We are alleviating the amount of pressure that it takes to decide on which content may be most relevant or trusted.
At the core of our strategy is really the omni-channel strategy that allows us to communicate with physicians, whether through outbound emails, could be on-site. More regularly now, it's actually off-site as well. The omni-channel strategy actually increased our engagement by 40% last year.
Ultimately, what we are doing with technology is we're trying to connect the dots within the individual clinician of the characteristics about them and the patients they treat, but also about the networks of clinicians together as a whole, so that ultimately, as a patient, you're getting the best care from your whole care team. By offering many different types of learning tools through different modalities, Medscape can truly be embedded in the clinician's day-to-day workflow and professional learning environment.
Over the last 5 years or so, we've definitely made a strategy to be much more local, so physicians can see what's going on at the global level, but also have a local perspective as to how it's impacting medicine and how it's treating.
What we have is hundreds of journalists, hundreds of professionals that actually look at information from both angles, make sure it's not biased, that it's coming from reliable resources, scan publications, make sure that the information is accurate and data informed.
There's no doubt that widespread use of digital health strategies has completely transformed how we interact with colleagues and also our patients. We're digesting our medical education in many different ways now. So platforms such as Medscape, I would say, are invaluable in our current environment of rapid evolution of guidance and evidence. It's a one-stop shop, really, for those Congress highlights, those latest guidelines, the latest evidence, those practice-changing messages that seem to be published on an almost weekly basis. The use of platforms such as Medscape do help improve my delivery of care for patients, ensuring that I'm keeping up to date, that I'm delivering the latest evidence-driven yet person-centered care in all medical specialties.
We're borrowing methods from health economics, outcomes research, real-world evidence, so that we can with confidence say that our education is associated with practice change.
Medscape is always looking to expand through partnerships. One example most recently is we formed a partnership with the American College of Cardiology to create a destination on Medscape in Spanish and Portuguese language for our Latin American audience. We've been very acquisitive as a company over the last 3 or 4 years, both in the US and in Europe as well. We've bought local platforms that help integrate into the Medscape portfolio of companies to expand our reach and provide even more physicians with the credible Medscape content that we offer. It's not just about one particular market, but the health equity that we can provide to actually make sure that physicians in Botswana are equally educated compared to physicians in the US is something that we're working very hard on to provide a health equity value across the world.
Medicine is changing so much. AI can help by enhancing algorithms and kind of helping to figure out efficiency around patient care, whether that's through diagnosis or whether that's through intervention. Technology cannot substitute for clinicians, and we know that, and that's why we're here to help the clinicians. So at the end of the day, all of us as patients need to have a clinician who cares about them and delivers quality care. Every patient deserves the best healthcare and needs to be represented in every part of the journey.